You hear the mic? Oh, yes, good. All right. Well, thanks everyone for coming. I want to thank Mayor Jimenez. I want to thank Don Steigman, Executive VP, Jackson Health. We have Tricia Robinson and Kim Begashevitz from the Avante Group, who is running this Miami Care Center. And then we have Mary Mayhew is our ACA Secretary. We're making a few announcements here today related to COVID-19. Today we're at the site of the old Pan American Hospital. It's now the Miami Care Center, and we're doing that to highlight a new partnership between the Miami Care Center, the Avante Group Skilled Nursing and Rehabilitation Centers, and the state of Florida to create a 150-bed COVID-19 dedicated nursing home. This is the 12th of its kind throughout the state of Florida. If you look at how this epidemic has affected different groups of people throughout the United States, it's clear that the most significant impacts have fallen on residents of long-term care facilities. And how you handle that and approach that, I think, has been probably the most critical thing that you can do on a government level. I think we've seen in areas of the country where you had really high fatality rates. Part of that stemmed from policies in which long-term care residents who were COVID positive in the hospital but medically stable were sent back into nursing facilities who didn't have the wherewithal to isolate them. And so, as we know with this virus, it spreads, and in those instances it was spreading amongst the most vulnerable. Here in Florida, we didn't, at the very beginning, we recognized that that would be something that would be very problematic. To have a COVID positive nursing home resident be put back into a facility where you couldn't have proper isolation would be a recipe for more spread, obviously more hospitalizations and more fatalities. And so we prohibited discharging COVID positive patients back into nursing facilities, and that was the right decision to do. It saved a lot of lives by doing that. It's prevented outbreaks. At the same time, you do have situations where either somebody who's in a long-term care facility is in the hospital but is stable and really doesn't require, fortunately, additional hospitalization. You also have instances, and because we've been testing a lot in nursing homes, where somebody will be identified as positive, but they're medically stable. And so if you're in a long-term care facility where you're not able to appropriately isolate them, leaving them in that facility runs a risk of having spread throughout the facility, infecting other staff and residents. And so we are requiring those facilities, and have been for some time, to transfer a COVID positive resident to a facility where isolation can be done. That has initially was hospitals, and so you have a lot of hospitals are boarding or have been boarding a lot of these long-term care residents. But we, in April, said, okay, obviously we need to isolate. There may be ways to do it that make more sense. And so Secretary Mayhew really led the effort to establish skilled nursing facilities specifically for COVID positive long-term care residents. And this serves both as a step up from a long-term care facility that may not have the ability to appropriately isolate a COVID positive resident, but also a step down from a hospital setting where you may have somebody who's COVID positive, but they are medically stable and don't require that level of medical attention. And so having this is really an important tool as we look at handling what's going on with COVID-19. And if you look, if you did an honest accounting, like in Florida, anyone who's a resident of a long-term care facility, whether they, if they die with corona in their facility, in hospice, in a hospital, that all counts as a fatality. If you did that uniformly across the states, you'd have a majority of the COVID-related fatalities would be amongst long-term care residents. And so this is where kind of the tip of the spear, where the most danger is from this virus. And this has been something that we've been constantly focusing on since March. And this is another step in that direction. So right now, or at least it's been for probably the last couple months, you have anywhere from 250 to 450 medically stable COVID-19 positive long-term care facilities in hospitals. Now that we have these 12 facilities, you're starting to see more and more admissions where this could serve as that step down from the hospital, and you're also seeing admissions where it could serve as a step up from a long-term care facility. Exclusively caring for medically stable COVID patients does serve that dual function, both stepping up and stepping down. So the Yvonne Group began operating this care center at the beginning of July. They've already admitted 18 patients. And they do have more on the way. They can currently staff up to 70 beds, and we think within the next few weeks they will have staffed 150 beds for COVID-positive residents of long-term care facilities. This is very important. So in South Florida, you now have the Miami Care Center. You have a facility in Broward that's COVID only, and then you have 2 in Palm Beach County that are COVID only. So that's a pretty significant number of beds to be able to care for people who are COVID positive, but care for them in a way that they're not spreading it to other vulnerable seniors in these long-term care facilities. You know, one trend that we've been seeing, and I think that Jackson can validate it, is, you know, as we've seen more traffic into the hospitals in the past few weeks, we're seeing a smaller number of residents of long-term care facilities admitted. And so, you know, look, we obviously would like this not to be here, not to have anyone admitted, but those residents of the long-term care facilities, and when they're admitted, you know, they have a much higher rate of mortality. And so to see that decline, you know, is something that's very positive. Now, we've done the testing of the residents and the staff from April through the beginning of June. We've now have a rule in place per Secretary Mayhew that all staff members of long-term care facilities need to be tested every 2 weeks. That's like 180, 190,000 people. So those tests are being administered as we speak. They've been distributed, I think, about 10 days ago. You're going to start getting more and more of those results come in. The first round we did this, the positivity rate for members of the staff of long-term care facilities was about 3%. We anticipated being higher, just because these folks are going to be reflections of the community. So if you have a higher positivity rate in Dade or Hillsborough, some of these places, those staff members are probably not going to be immune to that. So we anticipate seeing a higher positivity rate, but by doing the testing allows us to isolate the staff member so that they don't spread it to the residents. So all in all, I don't think any other state in the country has done what we've done to protect the vulnerable here in the state of Florida. This is another big step in that direction, and I think it's going to be a really important tool to help protect vulnerable folks, particularly at the time at hand. But this is just one thing that we're doing. We want to do more to be able to help with that. And so per Secretary Mayhew, she's been working with hospitals to ensure that they have the capacity and staffing necessary to be able to handle not just the needs of COVID, but also other needs. And, you know, we are seeing more traffic in emergency departments for non-COVID. That's not necessarily a bad thing, because what happened was in March and April, you saw a decline in people showing up for heart, stroke, and some of these key sources of mortality. People didn't just all of a sudden stop having heart attacks. People were not as comfortable seeking medical care then. So we've been stressing, and I think every hospital that we've talked to stresses, you know, look, we're open for business. If you have heart, if you have stroke, come in and get the medical attention you need, because if you put off the heart, then it tends to get worse. And we were in the villages yesterday talking to some of the ED docs, and they were saying that some of the patients now that are presenting for things like heart and stroke are presenting more severely because these symptoms started previously and they just didn't go into the hospital. So we definitely want that to happen, and we view that as very important. I mean, this virus is one part of health, health. There's a whole host of other things that we've also got to be concerned with. What we've done, the second announcement is we have at the state with ACA approved a temporary increase of 47 beds for Jackson's nursing home license. So that'll take them from 180 to 227. That'll be a force multiplier in terms of their ability to care for COVID-positive nursing home residents. So this increase of 47 beds has allowed Jackson to use a former rehab facility adjacent to Jackson Memorial to discharge patients from its hospital to a more appropriate level of care, and obviously ensuring that you have adequate hospital capacity. So we think that that's something that's very, very important. The final thing that we're pleased to announce today is, speaking with a lot of folks in these hospitals, if you look at the census, you've got I think it's been about 25% of the beds have been available statewide. That's been pretty consistent. Dade has a lot of beds available still, but this is the low season typically for hospitals in terms of their staffing. Usually the higher season is flu season. So they're looking at ways to utilize staff, and particularly at a place like Jackson where they have folks come in for things totally unrelated to COVID. They get into a car accident, they have heart problems, everybody who's coming in is getting swabbed and they're getting tested for COVID. Well, I think the rate you guys are seeing, 30 to 40% are testing positive. Now, they're asymptomatic. They're kind of incidental COVID positives in the hospital. They would not need to be hospitalized for COVID absent the other conditions. But what happens is if you're in and you broke your leg and you're an asymptomatic COVID patient, they still have to put protocols in place to be able to isolate and make sure that that doesn't spread to other parts of the facility. So that requires just more manpower. What the ratio, if it's not COVID, what's the difference in the ratio that you would have to have?
It's usually, right now it's 1 to 4 on COVID patients. Usually it's 1 to 6.
Yeah, so that you see kind of there. So there's beds available, but if you're having patients come in, test positive, for broken leg, they still have to do this 1 to 4. So when the Vice President was down with Secretary Azar, we were in Tampa on Thursday. Some of the hospital folks there were saying, look, we have beds, we just want to make sure we have enough folks staffing. And there's certain things they do to try to bring in staff as well. So HHS, they're working. We submitted a request for them to be able to send folks to Florida, particularly to South Florida. At the same time, the state, we want to do our part. We don't want to rely just on the federal government. So today, after talking with Carlos Magoya, after talking with other folks down here in Dade County, the state, we are going to be diverting some of our contract personnel to Jackson. So we're sending, starting tomorrow, 100 contract personnel, medical personnel, mostly nurses, to be able to augment their operations. And I think that that'll be something that'll be very useful for them, as they continue to deal with not only just COVID patients, but also non-COVID patients. And so we're happy to be able to be supportive, and we are standing by to be able to do more as the circumstances warrant. I did speak with the Vice President last night. Our request was put in at the end of last week. It is being processed, and so we do anticipate seeing some folks as well from there. But in the meantime, I think that this will be something that's very, very helpful for Jackson. And obviously, we're working with other areas of the state. I think Dade is, of course, seeing the highest positivity, and I think the outbreak here is different than some of the other places. But certainly, there's other areas as well that are going to want support, and we want to be there to be able to support them. So I'm excited that this has come to fruition here at this Miami Care Center. I think this is the right thing to do for our seniors in long-term care facilities. And just continue to stress that if you are in those vulnerable groups, if you're 65 and up, if you have certain underlying significant medical conditions, be very careful about avoiding crowds, avoiding close contact with people who are not in your household. We're seeing positivity in Miami-Dade. Some of the other places maybe not as high, but higher than they would be. So now's the time to really continue to be very cautious and continue to limit that close contact so that you can avoid being infected while this virus virus is out. And I know Mayor Jimenez and I were talking about, I mean, a lot of this is being driven by younger people. And they're just much less at risk. You look at the statistics, you know, if you're under 40 and you don't have a significant underlying condition, you know, the fatality rate is incredibly, incredibly low, which is a good thing. At the same time, you know, those folks interact with people who may be in vulnerable groups. And so that's definitely a concern, not only with staff in a nursing home, but just things like multi-generational living, visiting parents and grandparents. You know, now's the time to exercise that caution. So we've, at the state, have advised from really March that if you are in those vulnerable groups, to avoid crowds and limit the contact with people outside your household. And now, especially understanding that 20 to 30-year-old cohort, you're seeing more and more infections in that age group. There probably were always happening to a certain extent, but I think the transmission rate has increased over the last month. So it's very important to be careful and to continue to exercise caution. And I think we've seen, particularly the older folks, have done a really good job of being very cautious, you know, as this thing has continued to affect folks, you know, in the community. So I want to thank everyone for coming. We're going to pass it along to some of the other folks, and then we'll probably have a discussion before we take some questions. So, Mayor, do you want to chime in?
Thank you, Governor. And I'm just here to thank you and Lieutenant Governor and also Secretary Mayhew.
Can you turn your mic on?
I don't know how to turn it on.
To just, I think there's a button.
Okay. There's a button here?
I think so. On the top, maybe, or bottom? Okay. There you go.
Can you hear me now? Can you hear me now?
Yep.
Okay, good. All right. Thanks. I'm here just to thank you, Governor, Lieutenant Governor, and Secretary Mayhew for the incredible support you've given us here in Miami-Dade. This new facility that's open now is going to be a tremendous help to us here in Miami-Dade. We've had, you've seen the surge of people that we have in the hospitals and the ICUs, and also the use of ventilators here. And this is going to be a tremendous help to our capacity here to the residents of Miami-Dade. I also want to congratulate you. Thank you for the personnel that you shipped to Jackson. 100 additional nurses that are critically needed in order to open up even more capacity in our healthcare system here in Miami-Dade, and also your continuing efforts to help us with the federal government. And so, again, I'm here as a show of gratitude for all the things that you've all done. We talk with each other every single day. We are the county with the most cases, unfortunately, and I'm very, very happy to have your support and the Lieutenant Governor's and your Secretary's Mayhew's support. So thank you very much again for being here, and I know that I'll be asking for more as the day goes by, but also your message that we all have to be careful. It's our responsibility to keep each other safe. It's our responsibility to follow the rules. And if we all follow the rules, we can start to tap down, we can start to drive down the positivity rate that we have here in Miami-Dade County. We continue to have a positivity rate of above 20%, whereas 2 weeks ago we were down to 8%. And so it's up to every one of us, including, especially, we need to look at our younger population that we know had a tremendous spike in their positivity rate, which in turn has infected other people in Miami-Dade. So my message is thank you, but also every one of us needs to participate and be good citizens, follow the rules, and we can beat COVID-19. Thank you. Thank you,
Absolutely.
Governor.
And we've, I mean, really over the last month and a half, really have increased testing even more in Miami-Dade. I mean, you guys obviously have more cases, positivity rates now where we want it to be. But you're also testing at a very high clip. We have, of course, the main centers that we had from the beginning, Marlins and Hard Rock, but then the Miami Beach site, and then we have some of the walk-up and then some of the retail pop-up at like Simon Mall and everything. And so people are taking advantage of that, which is a good thing. We're happy to support the efforts with expansion of testing. All right, Secretary Mayhew.
If I could say it in Spanish, I'd like to thank
you. Oh,
you
yeah, go ahead.
Okay. All right. Estoy aquí para agradecer al gobernador todos los esfuerzos que ha dado para nosotros aquí el condado de Miami-Dade. Ha abrido esta instalación que va a tener 150 camas adicionales aquí para que ayudar a nosotros a combatir el COVID-19. También ha aumentado 100 enfermeros, enfermeras a Jackson, así que ellos pueden abrir más cuartos para aumentar la capacidad que necesitamos aquí en el condado de Miami-Dade para combatir el COVID-19. Así que estoy aquí muy agradecido al gobernador, a la gobernadora Janet Núñez y también a la secretaria Mayhew, que todos los días estamos comunicando nosotros y el trabajo que ellos están haciendo, la ayuda que nos están dando aquí en el condado de Miami-Dade a nuestros residentes, es algo que yo estoy muy agradecido a todos los esfuerzos que están haciendo y estoy seguro que les voy a pedir para más recursos y estoy seguro también que ellos van a responder con más ayuda, toda la ayuda que es necesario para nosotros, para aquí, para nuestros residentes, combatir este COVID-19. Y también le estoy pidiendo a todos los residentes del condado de Miami-Dade, por favor, sigan las reglas. Si todos podemos seguir las reglas, podemos triunfar sobre el COVID-19 y podemos regresar a una vida mucho más normal. Muchas gracias a todos.
Okay. Mary?
Thank you, Governor. Is this on?
Yep.
Yes, wonderful. Thank you so much. First, let me express my appreciation to the Avante Group. I think now that we have 12 dedicated isolation facilities, we may have lost sight of what an incredible commitment it is for a facility to come forward and agree to support COVID-positive long-term care residents, and to now have 12, and certainly to have this facility here in Miami, 150 beds to support, just as the governor described, a vision that we've had now for several months to both support our other nursing homes and assisted living facilities with the opportunity to transfer a COVID-positive individual out if they don't have the ability to appropriately isolate and to provide the necessary infection control standards. That helps us to prevent one case from becoming 10, 5 to becoming 20. That has been a critical resource for us around the state. And now acutely, as hospitals are seeing increased hospitalizations, to be able to support efforts to decompress our hospitals so that individuals who no longer need hospital level of care but are still COVID positive and in need of a long-term care placement, thanks to the Avante Group and their efforts to staff up quickly here, we have an opportunity to transfer these individuals to this setting to get the right level of care until they are negative, and then they can return to their nursing home, to their assisted living facility. So really grateful to you for your leadership, to your commitment, and Governor, to your unwavering focus on protecting our elderly. Again, we've talked about this throughout the pandemic, but in the early days, in the early weeks, we had hospitals who were very concerned when we said you cannot discharge back an individual to their nursing home, to their assisted living facility if they are positive. And frankly, we said if there's any risk that they are positive, they cannot go back. We know not only is that population the most vulnerable to fatality, the residential setting is at greatest risk for rapid transmission. We have nursing homes that are 40, 50 years old. They don't have some of the modernized air systems. And then if you're at 95% full, it's awfully difficult to isolate. And then, as you've described, we have looked comprehensively at the system. And government is not often accused of being nimble, but we have done everything possible to respond timely to the needs and the demands around the state. You mentioned Jackson Health and their rehab building, and we turned that around as quickly as we possibly could. We have partnered with the mayor and with his staff. I have their cell phone numbers and they have mine. And that we can't overstate how important that has been to understand regionally, to understand the areas within Miami-Dade where you've had outbreaks and what that has meant for the response and for the collaboration. And so really grateful not only to be here to celebrate what this asset has means to this area of the state, but also the continued partnership so that we are here for each other to continue to respond aggressively in this pandemic and in this crisis. So, Mr. Mayor, thank you very much for your leadership and for the collaboration that we have had throughout. Thank you, Governor.
Great. All right. Well, appreciate all your hard work. All right, Don, you want to make some comments?
Sure. First, I'd like to thank Governor DeSantis, Lieutenant Governor Nunez, the mayor, as well as Secretary Mayhew for supporting this project. So Jackson facilities do have capacity at this point. Our biggest challenge is staffing. And with the addition of these 100 nurses, this will help us to continue to grow the census if needed from a safety perspective. And then also what it does is it allows our nurses right now that have been on the front lines since March to have some additional relief and some additional assistance. When you take a look at what we're doing here, there's 100 nurses that will be starting over the next few days. 75% of those will be critically care trained. We will be able to start treating patients within a week. We need to make sure that we orient the nursing staff to Jackson practices and also look at their competency. At the same time, what we've been doing is we've been doing our own hiring. We've hired close to 100 nurses that will start between now and the next month, and those nurses obviously have jobs, they'll need to give notice, etc., and we'll need to get them into training. So from a capacity perspective, we think this is the right thing to do. This will move us to the next level. I also wanted to make sure that everyone was aware that the most important point, I think, of today is what the governor and what the mayor has indicated. Every member of the community needs to go ahead and make sure that they're wearing a mask, staying 6 feet apart, and frequently washing their hands. That will prevent hospitalizations and people coming into the emergency rooms throughout the county on that. I'd like to just share some other statistics. One, I'd like to thank Secretary Mayhew on that effort for our former rehab hospital being converted over. On any given day, we have 30 to 40 COVID-positive patients there that would have been in the hospital that we were able to now use that space for acute care patients. Today at Jackson, we have 345 patients as of 8 a.m. today. 25% of those are in the ICU. About 20% of the current inpatients are under 50, which that number, has grown. More than half of the current inpatients are under the age of 65. And to the governor's point, between 30 and 40% on any given day, these are patients that are coincidentally COVID that have come in for something else, a broken leg, a trauma accident, etc., that have tested positive. We do have plenty of vent capacity. That's not an issue. We're only using about a third of our ventilators that we have in stock. And so with that, I'd like to thank everyone again. This will be a great additive to our staffing.
Thank you. All right, Kim from Avante, do you want to talk about some of the things you guys are doing here?
Sure. Thank you, Governor. First, I wanted to say thank you to Governor the state of Florida, Secretary Mayhew, the Agency for Healthcare Administration, on behalf of all of us at the Avante Group, for your ongoing support to long-term care. All of your efforts and your resources have been invaluable to us as an organization and as an industry as a whole. So thank you guys so very much for that. At Avante, our mission statement is simply put, our mission is you. And when we opened this facility, that was the forefront of why we opened this facility. Simply put, our mission is you, the community of Miami-Dade, the residents, the families, and getting these folks a place to go that is safe, provide relief to the hospitals, release some of that capacity from the hospital to the nursing home setting. We have hired some of the most dedicated, compassionate staff in this facility that are all dedicated to the quality of care and outcomes of these residents that we have that have admitted so far and will continue to admit to the facility in the near future. Our goal is to get them better, get them back into their previous discharge setting, and provide them with our values and our standards as a company, that we provide quality outcomes and quality care to these residents. We've put in place stringent infection control policies and procedures in accordance with CDC, the Department of Health, and the Agency of Healthcare Administration to ensure that our residents are getting the most up-to-date, most current care, most current infection control practices provided to them while they're in this facility in order to have a successful discharge back to the community or their long-term care facility that they came from. So we are honored to take on this project. We are proud to support the hospitals and the community of Miami-Dade, and we look forward to this continued partnership. So thank you, guys.
Great, and thank you for what you guys are doing. I think this help. You know, one thing when you're talking about discharging these patients, I mean, one of the reasons why you kind of need this is we had the rule from the beginning or from the middle of March. If you're resident of a long-term care facility in the hospital, can't be discharged back to your long-term care unless you've had 2 negative tests separated by 24 hours. That was kind of the CDC guidelines. And look, that's safe. But what happens is these PCR tests, they can pick up dead virus. So there'll be people who will test positive, and then they'll try to get out of isolation, not just long-term care, and they'll test positive for another 2 weeks or even 3. I mean, so some people test positive 21, 28 days out past when they first tested positive. So it's a limitation in terms of some of the stuff that we have. So if you have a step-down facility, if they're still testing positive 3 weeks after, they're probably not infectious, but at least you don't have to run the risk. You put them there, and then when they get the negatives, they can go. But it's a limitation on this PCR testing that if you have RNA, it will pick it up even if you're not infectious or even if you're no longer sick, and that does contribute to you know, some of the seniors who've continued to test positive even when they're not showing any symptoms. We have the Lieutenant Governor here. You want to make a few comments?
Well, good afternoon. Thank you, Governor, and thank you to all who are here with us, Mayor, Secretary, and the folks from Jackson and Avante Group. It's a pleasure to be here, and I think today and this facility and everything that you heard the Governor announce is in alignment with his pillars from the very beginning of this pandemic. One of those most important aspects is protecting the elderly. We know that they're the most vulnerable. We know that not only here in Florida, but throughout the country, those in long-term care facilities, we're seeing the vast majority of those are what account for the fatality rate. So this facility and facilities like it, you heard the Secretary and the Governor mention, we have 12 throughout the state. These are facilities that are going to protect lives and protect our elderly, the most vulnerable of those that are suffering from COVID-19. And in addition, the Governor's focus on testing. We've seen tremendous growth in testing, not just here in Dade County, where we have the most cases, as you heard the Mayor mention, but throughout the state. We want to make sure individuals have access to testing. And then also in helping our hospitals and our health care facilities prepare for what we've seen as an increase in cases. You heard Jackson talk about their numbers, and again, the Governor's announcement today is a testament to his focused approach in dealing with this pandemic. It's a testament to his collaboration and continued cooperation, not just with hospitals and nursing homes and assisted living facilities, but with our county leadership. And I think that that is something that we're proud of. I think that's something we're going to continue to focus on and make sure that as we battle this pandemic, that we're going to have focus on data. We're going to have a focus on the Governor's pillars that he outlined at the very beginning of this pandemic. So, Governor, thank you for your leadership, and thank you to all that are here with us today.
Great. Well, thanks, everybody.
Sí, cómo no.
Go ahead.
Es un placer estar aquí hoy día con el gobernador, con el alcalde del condado de Miami-Dade, con el liderazgo de Jackson y el grupo que está llevando a cabo esta entidad y la secretaria del departamento. Este lugar aquí que estamos hoy día es un compromiso que ha tenido el gobernador desde el principio. Lo que él ha enfocado al principio de esta pandemia es enfocarse no solo en lo que es la capacidad de las pruebas, pero también también en proteger a aquellos que son más vulnerables. Sabemos que no solo aquí en el estado de la Florida, pero en todo el país, la mayoría de los fallecidos han sido miembros que viven en lo que es los centros, los nursing homes y los asilos. Y por eso este lugar aquí donde estamos hoy es esencial, es clave para proteger a aquellos que tanto han sufrido, y vamos a seguir nuestro compromiso con aquellos que son miembros de los asilos, y vamos a seguir enfocándonos en protegiendo no solo todos los floridianos, pero en particular aquellos que son miembros de los asilos y aquellos que tienen mayor de 65 años en adelante. Muchas gracias.
Great. Well, I want to thank the mayor. I want to thank Jackson. I want to thank the folks here at Miami Care Center. This is really important. The additional personnel for Jackson, I think, is going to be very, very important. We obviously want to continue to help, and we know that the federal government's going to be helping as well. The fact is, as was mentioned, if you have 30–40% of people with broken legs, some of these other things that are asymptomatic but testing positive, that increases the manpower because you need to isolate, you need to do the protocols that come with things like when you're dealing with COVID-19. And obviously these hospitals are going to continue to do that. But it is more labor intensive, even when you're dealing with the traditional patient who happens to test positive. So we're very sensitive to that. And I know that in speaking with the White House, speaking with the Vice President, the task force, they're very sensitive to that as well. So thank you. We really appreciate all your hard work. And particularly, I want to thank the folks, the healthcare workers, first responders in South Florida in particular. When we went through March, April, we got into May, the other 64 counties, had relatively mild cases and hospitalizations. I mean, South Florida was a majority of the cases, hospitalizations, and fatalities. And so you guys went through, a lot of that was brought down, I think, from the Northeast to here in ways that other parts of Florida didn't have to face. And so you kind of had to deal with that. Now I think you're seeing probably the more natural cycle of this throughout the Sun Belt, which is affecting, of course, other parts of Florida more so, but now again affecting here. And that's required a lot of hard work. Folks, the physicians, the nurses, other personnel, have done a really, really good job. I mean, we've been running these testing sites for months and months, usually 7 days a week. I know they were closed on 4th of July, but the National Guard has been very helpful. They've been at this for months and months. And so I just want to say thank you. And the people of Florida, thank all those folks who've been working very hard across the state, but I think particularly here in southern Florida, where you've had to face kind of two humps here. So, but we're here for you, and we're going to continue to do what we can. Yes, ma'am.
What is the situation with Remdesivir? We have had a family call us and tell us that their mother couldn't get the drug because it wasn't available.
So we have, what happened with Remdesivir is the federal government bought out a bunch of it, and then they sent it to the state departments of health. So our health department has distributed it to the hospitals as they've needed it. That is no longer what's happening. So now the next shipment that it's due in soon is not involving the state anymore. It's going directly from, I think, Gilead or whoever the distributor is, directly to the hospitals. I talked to the vice president, told him that we want to make sure that we don't have a gap. So they're working on it as well. But it's a change in how it's being distributed now. It's no longer coming through the Department of Health. It is going directly to the hospitals.
I have a question about contact tracing. So we've been learning a lot from some of the communities that have been able to get ahead and manage some of these cases, like New York. When they started their reopening plans, they had a pretty robust contact tracing program that dovetailed with that reopening strategy. Infectious disease experts this morning again reiterating to me that there are not enough contact tracers on the ground. This, as we are now experiencing this rollback, this economic toggle back triggered by the percentage case increase. My question to you is, why didn't you invest in more contact tracers in a hot spot like Miami-Dade and Broward County? And now that Miami-Dade is in this rollback, do you plan to invest more contact tracers?
I've already green-lighted $138 million for the Department of Health to support not just contact tracing, but other personnel. All the counties have gotten huge amounts of money from the CARES Act. The contact tracing is something that can be done, and it's a component. But understand, when you're talking about an asymptomatic a virus that largely doesn't create symptoms in people who are healthy and under say 50. You know, the contact tracing is not going to be enough. You know, you have to have, you know, some of the things we're doing with the nursing homes, some of the other things that you're doing with social distancing. So, but we've put in a lot of money for it. The counties have a lot of money to be able to do it. But, you know, New York, they went through the boom and bust. It wasn't because of contact tracing. I mean, that's the way it was. I mean, they had massive infections. You know, we've had a flatter curve, so those infections get spread out over a longer period of time. That was what everyone said we wanted, you know, back in March. But we've put $138 million from the state. These guys have money. I know you've invested in contact tracing, I believe, as well. But at the end of the day, you know, this is not a disease in which you get visibly sick, then you're contagious, so that if you isolate, contact trace, you do. Most of the people walking around with this either don't know they have it or have very mild symptoms and will never come in contact with the health. Another problem that you've seen is particularly the younger folks aren't cooperating with contact tracers, and so when they're trying to call, they're just not getting a lot of support. You do have some informal contact tracing that's gone on with younger people, where someone will have like a party at somebody's house and someone at that party later tests positive. Then they tell everyone, hey, I tested positive. Then those people go and get tested. So you do see some of that. But yeah, no, we've put in a lot of money for it. And but I think it's important. But it doesn't do the whole thing when you talk about an asymptomatic. So it's not as simple as saying you could just contact trace everything. Not when you have a largely asymptomatic illness. Yes, sir.
Question now for Mayor Jimenez, if I could.
Sure. Yep.
Sort of a two-pronged question for Mayor Jimenez. Please, let me ask a question. Mayor Jimenez, two-pronged question. Restaurants beleaguered, saying, oh my gosh, we thought we've done everything we've done. And then I want to ask you about gyms. What can you say to restaurant owners? I know you expanded it to allow outdoor dining, but what do you say to these beleaguered restaurants in Dane County who say we've done so much and oh my gosh, we've got to go back a step? What can you say to them, Mayor?
It's unfortunate that the way they do business means that people have to take off their masks. And taking off your mask in an interior space, according to our experts, is very... It's dangerous because the virus spreads as people talk. And so the nature of the business, it's not that they did anything wrong, it's just the nature of the business and the number of people and the percentage of positives that we have in Miami-Dade. And so the percentages are that in that restaurant, somebody, 1, 2, 3, 4 people may have COVID-19 and may be spreading it. That's why it's okay to do it outside. They can have outdoor dining, so that'll be allowed. In terms of the gym, we came up with a compromise. Now, people, when they go in the gym, they must wear their mask. They must wear their mask all the time. If they have to do something strenuous, then they have to do it outdoors. And so the gyms are going to remain open, but under a new set of rules, which they're okay with. And so we reached a pretty good compromise with that.
Follow up in English, please. How long do you think, Mayor, that will last for the restaurants?
It'll last for the restaurants until we get a positivity rate somewhere around 5%, because that's what the CDC guidelines call for. And so we right now are running at a positivity rate of over 20%. One of the reasons that I've asked, please keep your mask on, is so that we can start to reduce the positivity rate. And once we get that down to about 5%, then we can start to, again, open up the restaurants in the interior spaces of the restaurants. But until then, we're going to have to, go with what we got right now.
Governor, Miami-Dade has said that only Florida can contact trace and the Miami-Dade County cannot. Can you please explain why Miami-Dade County cannot contact trace?
He has hired contact trace. He
announced on May 14 that he was going to hire between 800 and 1,000 contact tracers, and he has not been able to hire them, and we asked them, and they gave us a statement saying that in Florida, only the Florida Department of Health can contact trace. Can you explain why during a pandemic?
Well, I don't think that I'm not sure that's correct. I mean, we want the county health departments to be involved in this, working with their local leadership. That's how they've been doing it the whole time. You know, as I said, we do have $138 million with CARES Act money that I approved, weeks ago for this and for other things that are significant. So, but I mean, I think that they should be able to do it and help do that.
Right next to each other. We have the county mayor who, as of last Thursday, said that contact tracing is in the state purview. You're sitting here, the governor of the state, now saying the county can do it. Can you guys just look at each other right now and decide who is hiring contact?
Well, no, he announced that he was going to do it, and so, and he told me, he gave us a heads up that they were going to be investing in some of it. We obviously have done it at the state level. I mean, as I said, it's a lot of CARES Act money. That was what the Department of Health, the State Department of Health requested of me. They created a plan. They had different levels. They had some that were a little bit less, but I approved the more robust plan, and so that's what they're going to be doing at the state level. But I just also want to just stress on this. Look, we understand now how this thing is transmitted. I mean, we understand kind of the things like, especially when it's hot out. You pack a bunch of people in a private residence, have a party, loud music, a lot of hooting and hollering. That is going to be a strong venue for transmission. They understand that if you maintain physical distance, the chance of you infecting somebody or being infected drops dramatically. We understand that doing things outdoors, fresh air, heat, and humidity, virus doesn't transmit as readily, in those circumstances. And so those things, I think, are really the significant behaviors. And then obviously for the vulnerable populations, to be limiting your close contact outside your home, to avoid crowds as much as you can, to be able to protect yourself. I mean, that is really, where we're going to be needing to do this. And so we're doing that. It's part of it, but it's really the behavior that I think that the mayor's been talking about, that we've been talking about, protecting the vulnerable, by far the most important. Clinical consequences in the vulnerable group, way higher than clinical consequences in the younger groups, but the younger groups are able to spread it to other folks. And so that is the message. Protect our vulnerable population, and then just follow the guidelines that have been put out, whether it's the state guidelines on social distancing, whether it's some of the things that the mayor has done here in Miami-Dade. We've really not had a lot of problems in Florida when folks have been following the guidelines. And I can tell you that throughout all, if you go from the beginning of May through the beginning of the second week of June, our statewide positivity rate was under 5%. That was 6 weeks. Sometimes it got as low as 3% statewide. Miami's was down in the single digits. And that was part of, our phase one. You had businesses open, but you had people, by and large, following the guidelines. And I think when that happens, we're able to have a lower positivity rate and to move it in a better direction.
So how many contact tracers do you guys have in Miami-Dade County on the ground? Do you know, that are working right now? How many contact tracers?
You'd have to ask the Department of Health for the exact number.
So Miami-Dade County has
One at a time. Samantha.
Miami-Dade County has published hospitalization data, how many people are being admitted to the hospital every day, but the state has not published that data on a county-by-county basis. The state has promised that data would be made available. I think last Tuesday you guys announced that, and I want to know.
So if you look, I mean, this report is something that you get, I get it every day from Department of Health. But they have so much raw data on there. I mean, people can pull out, all this information. I mean, it's really incredible the amount of, people do the charts and the graphs and everything. And so that's all available for folks, and they're able to, to do it. Now, obviously, not everything is presented in this report, but just an unbelievable amount of data, that's available for folks.
The data that she's asking about is not being released. She's asking specifically about the number of patients.
So all the data that goes into this is all available.
Spreadsheet from that data, Governor, it is not available. It is not available. And the data that's available that shows the total number of hospitalizations is a number that if you analyze it, it really does not give us any information. The only way for us to be able to inform the public in a better way is to know the number of, just like Miami-Dade does it. Mayor Carlos Jimenez releases that data every single day, and we're able to look. Here in Miami-Dade, the hospitalizations in the last 13 days have increased by 90%. We're able to see that because the county releases that data, but the state is not. And we're wondering.
Yeah, I mean, so I think a couple things to think about here is. So obviously, you are seeing, as the mayor has mentioned, we're seeing more traffic, particularly in Dade and southern Florida. Now, part of that is, when he's reporting, that includes these 30–40% of people who are incidental. So, you obviously have had increases for the COVID treatable, but you've also had increases that kind of supplement that. So I think when you look at in March and April when they were doing this, you didn't have testing of people coming in for other reasons at the time. If you're an expectant mother, you wouldn't be tested. If you're in a car accident, you wouldn't be tested. Now, all those people, are being tested, and so they're capturing a certain percentage of people, in the community who are largely asymptomatic, would not require hospitalization for this, but are doing it. And so, I think by them talking about their rate, now, I think Jackson's probably the highest that we've seen in that 30–40%, but I think others like Orlando Health and some of those, they're 20–25%, maybe a little less in the Tampa Bay area, but it's definitely a phenomenon, that we've seen. But I think that the message is, the census, I think that there were, 13,000, 14,000, 25% of the beds statewide are available. That's pretty consistent with where we've been. We've been, I think, between 20 and 30% since the elective procedures were put back in May, and then people have started to become more comfortable about going back to the hospital. So, we have abundant capacity, but I think that having some of the personnel support will be very, very important. I know some of the hospital systems have done a little bit on how they're handling elective procedures. I don't think you guys have gone to any type of second level yet. And so they have a lot of levers that they can pull. And then obviously I think providing this support for the personnel, the 100 for Jackson, obviously working with HHS to be able to provide more is something that's very, very significant and will allow the hospitals to be able to handle folks as they're coming in, not just for obviously the people that are hospitalized because of COVID, but be able to have the appropriate isolation procedures for folks who may be given birth, who may have a broken leg, who may be coming in for something else, but are also found to be carrying the virus. So.
State or county that's going to be hiring. Just let us walk away with updating our community.
So
are you committed to
we did. I've told you. I approved a plan, $138 million for the Department of Health. They can provide the details of that plan if you want to. So that's already been agreed to and approved. And that may be enough. I mean, to what we would need. It's a lot of people. It's a lot of stuff. But I think it's also important to just point out, when you have a lot of these asymptomatic 20-year-olds, there's not a lot of contact tracing that's being effective with them because they haven't been as cooperative, with doing it. And so there's limits to how much, if people aren't going to cooperate, how much that can be done. But that 138 million, I mean, that's probably the biggest commitment, that you've ever seen before in terms of doing that. So that's what the state has done.
You allow the county to hire. Where are these 100 nurses coming?
And then as we need to hear from you, or from you on Thursday,
March,
the state's review.
between March and right now.
So the nurses we have had contracts in place at the state this whole time in case there was just basic preparation, in case there was a need to have folks. We've used some of those contract nurses at places like test centers, some of these other things, in addition to National Guard. And so we have capacity to be able to bring some more folks on. Some of that may be shifted from things that they're doing that they may not need to be doing as much. So that's all just things that the state, we plan for contingencies and have the ability to execute accordingly.
From other states or just Florida? Where are they coming from?
Well, I think it's a mix. I mean, there's places you can contract with for personnel. How they choose to deliver that, we've obviously waived any out-of-state limitations. So if people are coming from Georgia or from other states, they'll be allowed to do that. But that's really a function of what's going on with the, how the companies are doing it. But those have been in place since March. We didn't really need to do much of it beyond helping with the test centers in March and April. Obviously, May, beginning of June was light for us. But then as we've gotten into now, we hear the demand signal. That stuff's ready, so you flip the switch. And then you need to flip another switch, you flip the other switch. That's just basic kind of planning to be able to meet whatever contingencies. And I would stress, I mentioned this yesterday, when we were in March, obviously there was a lot of people didn't necessarily know what was going on. The idea was flatten the curve, have a flatter curve, which meant that you'd push this out over a longer period of time. The places that went boom and bust, that have the highest death rates, that's what people said you didn't want to do. Now, by spreading this out, you now have the ability to have way more robust testing. They're testing everyone that comes in the door. No one could do that in March. It just wasn't being done. There wasn't enough of an infrastructure. You have that. You had PPE shortages in March. Now, not that PPE is never an issue, but the PPE lines are much better now. We have the protective equipment. The state has sent out huge amounts to hospitals and to long-term care facilities. So they're in a much better position. Of course, we mandated PPE in the long-term care facilities third week of March, and we've been supplying them ever since. So you have that, which is very significant. You also have some of the different treatments that have been used. The steroid, you have the remdesivir, you have some of the other techniques which are much better and delivering better patient outcomes. I mean, the fact of the matter is the mortality rate for people who are hospitalized now is lower than it was in March. And I think that's true worldwide probably, but certainly true in the United States and here in the state of Florida. So you have that, which is something that is really, really significant. And then, of course, now with having long-term care facilities that are COVID only, you're in a situation where obviously we don't want to discharge a COVID-positive patient back into a facility. We've never done that. But you also have the ability where these facilities can be stepped down from hospitals. So you don't have hundreds of people dwelling in a hospital who don't necessarily need to be there, but then can still be appropriately isolated. And so all these things that we now have in place is much different than was in March. And remember, the whole point of the curve, flattening the curve, was to make sure we had enough health care capacity. People understood that you have a virus, people will get infected. You want to shield the vulnerable, of course, but you want to be able to deal with what ends up happening. And so we're in a way better position today to be able to do that. And I think that that's something that has taken a lot of work. It wasn't obviously all just the state. I mean, we were involved in some of it. A lot of the hospitals, the physicians have gotten much better at this. So that really is the nature of what we were trying to do. We obviously want to see get over this wave as soon as possible, but we have the tools in place to be able to deal with it in ways that not only Florida didn't, but really no state in the country had it when we're talking about the beginning or middle of March. It's just something that wasn't there. Now it's there, and we're much better off to be able to handle it. All right, thanks everybody.
Breaking news here in Hillsborough County, folks. Want to jump here on stream and let you know about this. Before we break down the governor's press conference very quickly, we have breaking news into our newsroom. Hillsborough County schools will be requiring masks for everybody, teachers, students, staff in the fall. And masks will be required where social distancing is not something you are able to do. So please stay tuned to here on WFLA Now and on WFLA.com for that very latest information today. So Governor DeSantis just spoke in Miami. He was discussing hospital personnel and hospital capacity in South Florida specifically. Good afternoon, everybody who is still following us here on WFLA Now in this stream that the governor spoke for almost an hour, the governor and other officials. Facilities for only COVID long-term care are opening. There are now 12 of those in the state, including Miami. That means if someone who was in a long-term care facility goes to the hospital, they are now not allowed to be released back to their long-term care facility. They will go to one of these facilities, and there are, again, 12 in the state, now including Miami. I took many notes from the governor's press conference here, folks. He says that hospitals are seeing fewer residents of long-term care facilities admitted to hospitals. And again, all staff members of assisted living facilities must be tested for COVID-19 every 2 weeks. The governor is making sure hospitals have room for patients, not just, he said this yesterday as well if you joined us, not just coronavirus patients, but for those more comfortable now being able to go to the hospital. Say you were sick a few weeks ago, had an ongoing issue, and you're now more comfortable going to the hospital right now amid a pandemic, that he wants to make sure that hospitals have room for those patients as well, emergency patients. He also mentioned his visit to Tampa with Mike Pence, that healthcare workers here are concerned that they are, I shouldn't say concerned, but they want to make sure they do have that space moving forward. So let's break down some numbers. Actually, let me look at some comments, folks. See if any hashtag Hey Daisy. We're going to run through these numbers because we will probably go ahead and talk some numbers too when we're talking about the Hillsborough County Schools mask order. But 7,347 new cases today, bringing our total to 213,794. 63 new deaths were reported today as well. So that's a total of 3,841. Percent positivity for new cases, that's a big thing today. The percent positivity is the number of people who have been tested for coronavirus for the first time divided by the total amount of people tested for that day. And that was 16.27%, which was a record high from yesterday. The total percent positive of all tests, which include folks who have been tested on multiple days, as you heard the governor say, these folks need to have two negative coronavirus tests before they can go back to their assisted living facility. So there are people being tested